Of all the surgical problems that can happen at the anal region, the most common are piles, fissures, and fistulas. Let us discuss now about the differences between these commonly occurring conditions. Hi, I am Dr. Praveen Koduru, Senior Consultant Laparoscopic and Laser Surgeon with Sree Nandaka Laparoscopy and Laser Center. Hemorrhoids, commonly called as piles, are swollen veins in the rectum and anal canal. They can be internal hemorrhoids which are inside the anal canal, or they can be external hemorrhoids which are under the anal skin and they protrude outside. Whereas an anal fissure is a small tear or a cut in the lining of the anal canal, typically occurring in the lower part near the anus. Whereas a fistula in ano is an abnormal connection or a passageway that forms between the rectal or anal wall to the area around the perianal skin. Now, why do these conditions happen? Piles can be caused by increased straining while passing stools, chronic constipation or diarrhea, sitting for extended periods, or obesity, a low fiber diet, pregnancy, or even genetic predisposition. Increased pressure on the blood vessels in the rectal and anal area can lead to swelling and inflammation, resulting in formation of piles. Anal fissures often occur due to factors that cause trauma or damage to the delicate lining of the anal canal. Some common causes include passing hard or large stools, the size of which are larger than that of the anal diameter, intense straining during process of passing stools, chronic constipation and diarrhea, and these factors can cause to tears or cuts in the lining of anal canal, resulting in anal fissures. Whereas anal fistulas typically develop as a result of an infection near the anal canal or in the anal glands. Conditions such as perianal abscess, sexually transmitted diseases, trauma, or injury to the anal region or tuberculosis can lead to the formation of anal fistulas. Now, what are the symptoms of these conditions? Symptoms of hemorrhoids or piles can include discomfort, especially during bowel movements or when sitting. They can also cause itching or irritation around the anal area. Bleeding, which is typically seen as bright red blood on toilet paper in the toilet bowls splashed over the stool, and also as swelling or lumps around the anal verge and mucus discharge. Remember, piles cause pain only when they are inflamed or thrombosed. Usually they don't cause any pain. Symptoms of fissure include severe pain during or after bowel movements, mostly feels like cut with a blade in the anal canal while passing stools. Bleeding presenting as bright red blood mixed with stool, also cause itching and irritation, also cause spasms or muscular contractions in the anal region, leading to more constipation and fear of passing stools. Symptoms of an anal fistula can include pain and persistent discomfort around the anal area, continuous discharge of pus or blood from opening near the anal canal, a tender or firm lump near the anal region, also redness or irritation around the opening of the fistula. Finally, recurrent formation of abscesses in the perianal region. So these are the symptoms of fistula. All these conditions are different in their etiology and need different line of management. So what are your options? Treatment of piles include dietary changes and lifestyle modifications, which includes high fiber diet, adequate hydration, medical treatments which include topical ointment like lignocaine jellies, pain medications, sitz bath with warm water, and finally, if these measures fail, surgical treatments like hemorrhoidectomy, stapled hemorrhoidopexy, hemorrhoidal artery ligation, or the latest procedure laser hemorrhoidoplasty. Now coming to treatment of fissures, it includes lifestyle changes like eating high fiber diet, daily usage of laxative to facilitate easy passage of stools, local application of ointments containing sphincter relaxing medication, taking sitz bath with warm water to promote relaxation of the sphincter muscles. If fissures don't respond to these treatments, surgical procedures like a laser sphincterotomy, which involves surgical loosening of an anal sphincter, will be considered in severe or persistent cases. Whereas the only treatment for anal fistulas is surgical removal of infected fistulous tract. This can be achieved by procedures such as fistulotomy, where the fistulous tract is laid open, or by placement of a seton, which is a thread which is applied in the fistula tract, or by a laser fistulectomy where laser energy is used to ablate the fistula tract. Of course, complex fistulas need advanced procedures like lift or flap advancement procedures. If you like the information I have provided, kindly like, share and subscribe to my YouTube channel. And if you have any queries, kindly comment below. I'll be too happy to answer to them. Thank you.